Hello and welcome once again to Strong at Home. I'm Dr. Brenda Murphy, an educational psychologist at Sail Away Learning and Academy, and we're so glad that you're here with us today. The purpose of Strong at Home is to help you to be strong at home, and by presenting information that will help you understand your children and yourself a little bit better. And today we're continuing our series with Dr. Erin Plyler, who is an audiologist. Welcome, Dr. Plyler. Dr. Plyler is an audiologist at the University of Tennessee Department of Hearing and Speech, or Audiology and Speech. Thank you so much for being here. Dr. Plyler is a pediatric audiologist, so she's speaking right to our group of parents. So thank you once again for being here, Dr. Plyler.
Yes, thank you for having me again.
Last time that we met, we were talking about the three different ways that auditory processing disorder, which is a form of hearing loss, manifests itself in different children. We talked about there was one that would manifest with right hemisphere in the brain, and one in the left hemisphere, and then one in the cortex. And so I guess the bottom line, as I'm saying those terms, is it's not a hearing problem, it's a brain problem that many children are having. So we talked a little bit last time about how that brain isn't functioning, and you showed it to us, but it's my child, and I really want to know more about what's going on with my child, not just this general brain thing. How can you, as a pediatric audiologist, help me?
It's time for evaluation.
Oh, okay.
Yes, it's time for evaluation. And if we want to pull up our screen, we kind of talk a little bit about what needs to happen to have that evaluation. Okay, we're going to start here first.
Oh, okay.
As far as the testing goes, what we really like to have are different professionals join us in our diagnosis of the child. And so as far as an audiologist goes, my job would be to rule out the peripheral hearing loss and see if there is any central processing problems going on. I'd also want input from a speech language pathologist who evaluates the language portion.
Right. And we talked a little bit about that they are in the same kind of basket of the hearing disorder, but you're very different in what you function. So both members are important.
Mm-hmm. It looks like the next one is an educator.
Yes. Hooray. And, y'all put us right there, almost in the middle, which is where we feel like we should be, because very often that's where the first problem, the second problem is parents are knowing when their children aren't listening or hearing them properly. But we as educators do find that maybe the child is performing differently in the classroom than they are when they're with their families. So it's important because that auditory processing disorder is really impacting the effectiveness that we as educators have with those children, that we can do, try our best methodologies, and sometimes that child just isn't getting it.
And so you're right. The educator is really an important person in our process. And I want to know what that educator has seen in the classroom with the child or my patient.
Yeah. And so actually, as an educator here at Sail Away, we also have someone who's in that next category, the psychologist. The psychologist does a battery of diagnostic psychoeducational assessments, is what we call it. And in that, we determine their level of cognitive skills. Sometimes we can see if there's suspicion of attention issues. And it also shows whether they have actually been learning anything. And so we put a report together for that. And so both the educator and psychologist are part of this multidisciplinary team. And of course, they have the parents. So they also contribute. Can you see us all sitting around this table together? And Dr. Plyler, who else do we need to invite along with this team and the parents?
The physician, usually. We want to know, is there any pathology that's going on that's creating these problems? And so that's when we would send to the physician to make sure that we've ruled out anything of that sort.
Yeah, and there can be a number of issues with that, because you said that for some children becomes a peripheral problem, that they may have experienced some sort of a trauma to the brain at birth or before birth that's going to impact this well, it's really auditory processing disorder now. Yes. So that can be a factor as well. So we would want everyone to come into this team so that we can do the best for our children as possible. So say I have a student and we've worked with that student for a year or two academically. We have a really good psychoeducational profile for them. But yet all that we're doing, we're still seeing some lingering issues either in literacy, in speech, or in language. So what would be our process? Because who would we go to next? Are we going to go to a speech language pathologist, or do we need to go to the audiologist?
The audiologist, if you are suspecting maybe a processing problem, would be the first person to go to. They are the individual or professional that will give you the diagnosis. And so the audiologist will be your next step. Okay,
so what are we going to expect? What can the parents expect when they go for the audiologist profile? And I think we have a list of those things so that parents will know exactly what's going on. There it is. So,
okay. So what we like to have before we see a patient or your child is we'd like to have all those evaluations that you've had done by the other professionals.
What are some of the things you might be looking for in those testings that some of us have done?
So as far as if they're in speech, I'd like to know, what are they in speech for? Is it an articulation problem? Is it a language problem? Is it a social problem? Because I'm trying to determine what area of the brain isn't processing correctly. And so if I think that they also have a language problem, I'm going to think they probably have a left auditory processing disorder if they have one. We want all of our evaluations to come together and make sense, and everybody's kind of seeing the same thing.
Right. And this gets very fine-grained, if I may use that expression, because with our psychoeducational, we can kind of hint at some auditory processing issues going on. We can look at those numbers, especially on the IQ testing. Yeah. Usually we use the WISC, and that gives some determinant, but it's very different than what you as an audiologist will look at. You will get finer grained, kind of like a magnifying glass, that we can see, yes, we kind of see they're having a problem with this particular cognitive issue. But what you'll do, if I'm interpreting this correctly, is you like take a microscope and you look more closely at what we're seeing. Is that correct?
Correct. That's exactly right. The next thing that we want to see is we can't test a child for auditory processing disorder until they're 7.
That's very important.
Yes. Yeah. And the reason for that is, as we talked about previously, it's a maturational issue within their central auditory nervous system, and it's not fully mature till age 12. So if we test a 6-year-old or a 5-year-old, their results are going to be so variable that there's nothing to compare them to. So I might do a test and they might get 6% correct, and that might be normal. So at 7 is really when our norms start for processing.
That's really interesting, because normally, like some of our tests, our psychoeducational tests, we go down to, well, some of them go into very, very young, but certainly at 3, there are a few that we can do at 3, 4, 5, and they're tests specifically for that age group. But what I hear you saying is that when it comes to auditory processing, it's not, there is just not a test because children have not developed that area of their brains enough, or that hasn't developed enough to be a successful assessment, that it's just not there.
That's exactly right. And it's also why a lot of times we're the last person to see that child. They had, were younger than 7, and they were seen by all these other professionals and had evaluations. And there comes a point where they're like, I just feel like there's something else going on. And then we get them in our clinic.
That's really revealing. So now that my child has turned 7, what happens next? So then I can call up and say, can I get an appointment with Dr. Plyler for an assessment for my child?
Yes. And we're happy to see you at age 7 now. Yes. And so what you will do is you need to plan about 2 hours for the evaluation. And we bring you in and we do a case history with the family, but we don't want the child to be in the room with us.
Yes.
So we go ahead and take the child to start testing while somebody else is talking with you and getting the case history.
So that helps, makes good use of your time, and the parent doesn't have to come in ahead of time.
Right.
That it all happens simultaneously. That's really good.
And the parent can feel free to talk to us since their child's not sitting there listening.
Yes, absolutely.
And so as the testing begins for the child, the first thing that we will do is rule out that there's any peripheral hearing loss. So they'll sit in the booth and they'll hear those beeps and they'll raise their hand that they heard those beeps. And to make sure there's nothing going on in that periphery that we need to deal with. Then we start our central testing. And our central testing takes about an hour to do. And we tell the kids that they're listening games that they have to do with us. Following the testing, we have 3 things that we used as our goal for the testing. The first thing is right after the test, we will come back and speak with you to let you know, 1, does your child have an auditory processing disorder? 2, if so, where was that breakdown? Right, left, or central? And if they do, now what are we going to do to help you? How are we going to help you navigate through this?
That's really important. We go through those tests, and it's very important. I have one quick question that is just popped up as you were saying you were doing the peripheral and the central. Is it possible for children, when you are doing your assessment, that you discover both peripheral and central process or central hearing problems?
Yes. And so when we do that hearing test, if we find that child has a peripheral hearing problem, then we know that they will have a central problem because that signal has come in and is distorted at that point. So it's going to continue to be distorted as it travels up. But we wouldn't do testing anymore. We would stop at that point and we would talk about hearing aids to help treat that peripheral hearing loss.
Right. And so then once you get the peripheral hearing loss maybe managed as best as you can, then you would have them come back and do testing for the central hearing loss. Is that possible?
We can do the central part and refer to the speech therapist to start treatment.
Oh, so there are lots of different avenues that we have to take. And, yes. I really want to hear those avenues because I know it sounds like to me there's a lot of if-thens. If this happens, then we do this. And we may have 2 or 3 choices for the thens. So I'm going to ask you again, Dr. Plyler, will you come back and tell us how the result of this assessment that you've done with the child is going to put feet to it so that we can actually make a difference in the child's life?
And that really is one of the most important things.
Yes, absolutely. Well, we'll end on the important thing, and as we all do, and I'm sure that our listeners will certainly be excited to know what some of those things are. And in the meantime, we'll end our session today. The Lord bless you and keep you. The Lord make his face shine upon you and be gracious to you. The Lord lift up his countenance upon you and give you peace. So peace to you, Erin, Dr. Plyler, and to all of you out there. We'll see you again on Strong at Home.